Today, let us draw together the relations of the shoulder joint. Beginning with the glenoid fossa. Now, in this diagram, we are looking at the shoulder joint from the lateral aspect. Now, we draw the glenoid labrum, which is the fibrocartilaginous rim around the glenoid fossa. Then, we are going to draw at the supraglenoid tubercle the attachment of the long head of biceps brachii. It can be noted here that this particular structure is both intracapsular as well as intrasynovial. So in green we are drawing the fibrous capsule, and anteriorly we have left it deficient. In pink now we draw the synovial membrane of the joint, and through the deficiency we draw the subscapular bursa. Now, superiorly we draw the acromial process and the coracoid process, which are joined by the coracoacromial ligament, and together they form the coracoacromial arch. Now, drawing the muscles. From the coracoid process, we draw two muscles, which are the short head of biceps brachii and the coracobrachialis muscle. There is another muscle which is attached to the coracoid process, mentioned in the comment. A muscle which lies anterior and forms a very important relation of shoulder joint is the subscapularis muscle. This muscle is also a part of the rotator cuff. Then we draw a muscle which lies superiorly to the shoulder joint, that is the supraspinatus. The second muscle is the infraspinatus, another important muscle of the rotator cuff, and also lying posterior along with infraspinatus is teres minor, the fourth muscle in the rotator cuff. Inferiorly, we also have the attachment of the relation of the long head of triceps brachii, which notably is extracapsular and extrasynovial, attaching from the low infraglenoid tubercle. The last muscle which lies inferior to the shoulder joint is the teres major muscle, a muscle which forms an important posterior and superior relation of the shoulder joint is the deltoid muscle, a large muscle covering the shoulder joint. Finally, the muscle which lies anterior to the shoulder joint is the pectoralis major muscle. The neurovascular structures which are related to the shoulder joint anteriorly are the axillary vessels. From the third part of the axillary artery, an important branch arises which lies inferior to the shoulder joint, the posterior circumflex humeral artery. It lies over here in the quadrangular space and is accompanied by a branch of the posterior cord of the brachial plexus, which I will now be drawing in yellow, and the branch is the axillary nerve. So, important inferior relation of shoulder joint are the axillary nerve and the posterior circumflex humeral vessels. Another important notable structure which can be drawn over here is this vein, which lies in the deltopectoral groove, the cephalic vein. Finally, we can complete this diagram by putting in the direction orientation. However, this diagram is incomplete without drawing the subacromial bursa. So with this, the relations of the shoulder joint are complete. Thank you.